Hey guys, this is a different video than normal, completely un-beauty related. I wanted to share my story and any information that I've learned about a disease or a disorder called TMD, which stands for Temporomandibular Joint Disorder or Dysfunction. A lot of people just call it TMJ, but that just is the name of the joint, temporomandibular joint. It's the jaw joint, that the cartilage that separates the jaw from the rest of the head, I guess. I was officially diagnosed with TMD a couple of weeks ago. I guess where it all started was probably I was a tooth grinder and clencher when I was asleep, or when I am asleep. I still do it. I've done it all my life as far as I'm aware. The first person that told me I was doing it was my mum when I was 18, and I slept in the same bed as her and she heard me grinding my teeth away. I've been wearing a splint on and off for the last 5 or so years for that, but that only protects your teeth. It doesn't protect the jaw and, you know, the muscles and everything else, because you're still effectively clenching and grinding, just not touching your teeth. I've suffered from anxiety. Well, I guess I've been diagnosed with suffering from anxiety for the last 4 years or so, which increases clenching of teeth and grinding and all that good stuff. And I guess that has contributed to my TMD. I've been getting shoulder pains and neck pains for probably the last couple of years, but it was only towards the end of last year that I started to get pain in my jaw joints. Well, not my jaw joints, just my whole sort of cheek, face area, and sort of around the jawbone and around the front as well. I did think I had swollen glands a lot of the time to start with, but it turns out it was actually my muscles. I think I went to my doctor first. She actually referred me because I felt like I was having a lot of sinus pain up here and down here, which I've also been having since I was about 18. I went to an allergist who checked what I was allergic to, and it was just the usual, like dust mites and grass and things like that. So she didn't think that would cause the amount of sinus or facial pain that I was getting. So I went to an ENT. I was referred to an ENT. I had a CT scan, and he said, I've got mild, I guess, mild symptoms of sinusitis, not enough to cause the amount of facial pain that I've been suffering from since I was 18. So he said I should probably go see a specialist. My dentist at this point had tried me on Valium to try and I guess break the habit. If he thought, you know, we could try me taking Valium for maybe 3 or 4 nights, and that could be enough just to break the grinding, clenching habit. And also put me on a quite high dose of Voltaren as well. So I felt great for about 3 days while I did that, but once I went off, the pain came back, so that didn't really help. So eventually I did go to see a specialist, a TMJ specialist, named Professor Jack Gershman, and he sent me off to get an MRI. That came back and confirmed that my right hand joint is severely damaged, but not to the point where it's not functionable, so it could still function. However, it's at the point where it's actually slipped out of its socket, so it's never actually where it's meant to be, which means that it's bone on bone on this side, which is not good at all. It means obviously my bones are grinding together, and that can cause osteoarthritis, and the fact that the socket or the joints moved, it means the whole sort of muscle group here is not really where it's meant to be. It's all strained and doing God knows what, probably damaged, and that's why it's quite painful. The left hand side is the joint's quite damaged due to the grinding as well, but it's still functioning and in the spot where it's meant to be, so it's still in the socket. I think it does slip out every now and again. When I yawn or open my mouth really wide, I can sort of feel like it's almost like a jolt or a shock on this side, and I think that's sort of just the this the cartilage slipping out and slipping back in. And I can actually, it feels like every now and then when I'm feeling quite a bit of pain in this joint here, I feel like I can click it back into place. I feel like a little pop if I press in here. It's weird, and I don't even know if it's probably making it worse, but it provides a little bit of relief. And I think it's just me slipping it back into the right place, but then it comes out a few minutes later. So that's my story with TMD. My next step is to get a new splint. I've had the molds taken with my specialist, with Dr. Gershman, Professor Gershman, and the idea is that splint will try and coax the joint to go back into the place where it's meant to be, because it's still hopefully functioning. If we can get it back into place, that would be awesome. He said some physiotherapy could potentially help that as well. I don't know how likely it is to be able to get a joint back into place. I guess it depends how damaged the bone is already, and the muscles as well, I guess. I hopefully don't have to, well, maybe, might have to consider jaw surgery at some point, but it sounds as though that is more often unsuccessful than successful, and people can end up in a lot more pain than they were in to start with, which I would like to avoid, because I think either way this is potentially going to get worse anyway, and I would rather try and avoid pain or more pain for as long as possible. Professor Gershman spoke a lot about stem cell research, which kind of, I think he was trying to make me feel better, but I think when you're trying to comfort someone and you say, hey, maybe one day you can grow a new joint, it kind of made me feel worse. But actually one of the leading stem cell research groups is actually based in Melbourne, and they're in the final stages of study and testing, so it is possible that in a couple of years, you know, they might be able to inject stem cells into my jaw joint and I could potentially grow a new one. So fingers crossed that that could happen. And they might, you know, the fact that I do have an issue that will affect everyday activities like eating and potentially at some point talking might put me at the top of some kind of list that they might be working on. Who knows? That's sort of long-term stuff. So I guess we're just hoping that the splint and the physiotherapy could assist. At this point, my grinding isn't really an issue because it's already done the damage, unfortunately. I was looking at biofeedback systems. I know you can buy them online, these, you know, weird headbands that you wear in your sleep and they beep when it registers that you're clenching your muscles or grinding your teeth. The professor said it's just not worth it for me because the damage is done. So yeah, if anyone's at the point where they grind their teeth, maybe try whatever you can to stop grinding, because you could end up with a dysfunctioning jaw joint eventually. Hopefully for me it won't get much worse because it can be really debilitating. Your jaw joint can lock either in an open or closed position, so you literally could have a locked jaw. You get to a point where you can't really eat solid foods because it hurts to chew, which in my case is already true, and I can feel these bones crunch against each other when I'm eating sometimes, which is really not pleasant at all. I try not to eat chewy things like chewy lollies and things like that, although it really sucks because, you know, I like food and I don't want to have to eat my meals out of a straw. So fingers crossed that, you know, the things that I'm working on with the professor will help. I'm happy to give updates on how I'm doing, and I would love to hear stories of other people, what you guys have done. I know it's sometimes hard to know where to look. I mean, I went to my doctor, allergist, ENT, dentist, and then the specialist. So I've been to 5 people to work out what's wrong with me, and I know some people go to a lot more people to try and work out who they need to speak to. So in terms of, you know, I guess more information, I'd love to hear it, because that's sort of, the internet's where I've gotten all my information. And unfortunately with this disorder, it's a lot of the time the stories you read are the worst ones, and it's quite disheartening. So I hope there's more people like me that have caught it at a point where you could potentially be able to, you know, kind of reverse the effects. Maybe not reverse, but slow down the effects more than anything. Because it's not a pleasant disorder. It's quite debilitating. It's pretty much constant pain. I have been having massage therapy. I've been getting trigger point massages on my jaw, which is, I don't know if it helps, but it feels, you know, I get relief afterwards. And I've also started to get some dry needling in my joint, in my muscles, which I do feel has helped quite a bit. It's not something that cures, but it definitely relieves the pain for a little while. So I don't know if you guys, you know, might want to give that a try if you haven't already. Unfortunately, my masseuse has just quit, so I've got to try and find someone else, maybe in the city, that does trigger point therapy. So if you know anyone in Melbourne that, you know, is good at doing TMJ, neck, shoulder massages, I'd love to know. Anyway, this is quite long, but I felt like I wanted to share. So I'll talk to you guys later. Bye.